A major medical turning point, and it's good news. The American Cancer Society reporting the largest ever single-year drop in cancer death rates across the country. Researchers crediting several breakthroughs in treatment of lung and skin cancer for the decline, which has dropped by almost 30% since 1991. Dr. David Spigel is here. He is the Chief Scientific Officer at Sarah Cannon Research Institute. And I'm very happy to report this story. If you would start, Dr. Spigel, by telling us more about the biggest factors behind the drop.
Yeah, thanks for having me. I think exciting news. For the first time in a while, we're seeing cancer death rates drop at a significant rate, and probably one of the biggest explanations for that is a drop in some of the major cancers, including lung cancer. So some of the advances that have occurred in lung cancer treatment have contributed to this drop in death rates. A really exciting finding.
And do you think this trend will continue?
I think so. I think these data reflect advances that actually maybe go up until about 2016, 2017. And the pace of development is so fast right now. What we're seeing today in 2020, I think those advances are going to continue to cause the death rate to drop. And so a lot of reason for excitement already from data from just a few years ago.
You know, Dr. Spigel, is there an awareness component? I mean, people more aware of the dangers of smoking. They're much better about wearing sunscreen, you know, lifestyle changes.
Yeah, I think you're exactly right. I mean, screening, of course, continues to be very important. But as you say, lifestyle changes, smoking, exercising more, eating right. I mean, these lifestyle changes all work into a kind of package of factors that help lower death rates. I think the other big thing is cancer research. So trying to find new therapies, advances in targeted therapies, therapies that help boost the immune system. These are making major impacts in how patients are doing.
Yeah, absolutely. And about that excellent work by these researchers, do they have all the tools necessary to go further with cancer research, or are there remaining obstacles in place prohibiting cancer research development?
Well, I think the biggest, there's a lot of obstacles, as you point out. I mean, I think there's a lot of patients who want better therapies, of course, and have access to clinical research. We probably have the most work to do to get more patients exposure to clinical trials, access to new therapies, so that these things can get tested, and then we can see if these lead to better outcomes. So improving how we do research, I think, is going to be the major next challenge for us.
And can we expect the death rate to drop with other types of cancer?
I hope so. You know, I think these advances in targeting why cancers grow, in improving how the immune system reacts to cancer, shouldn't just be unique to cancers like melanoma or lung cancer. And so we know there are many cancers where these principles can be applied. I think we just have to continue to do more research to find these answers.
And finally, one thing that you might say to our viewers, Dr. Spigel, how they can help the researchers. I mean, you know, if you feel something, see something that looks unusual on your body, don't wait to get it checked out, right?
Well, that's absolutely true. But the other thing is, feel free to ask questions. Have conversations with your providers about what are these advances that are being talked about in the media, in the newspaper, on the news. Do we have access to these things? How can I get those? Do they apply to my care?
Mm-hmm. And finally, again, we're touting the fantastic work of researchers. Do we have enough access for people who maybe don't live in some of the bigger cities so they can get these early pre-screenings done?
Well, that's a good question, you know, when it comes to just routine care, of course, and then access to research. Certainly a lot of great places around the country. I know one of the things we work out at Sarah Cannon is making sure people have access in their own communities so that they don't have to travel across the country or to major cities to get that access. But a lot of work still to be done.
Great work so far. Keep up the great work, Dr. David Spigel. Thank you very much, sir.
Thank you.
That really is great news and very encouraging.